Welcome students, still on Nursing Council and NCLEX based examination study. Now there are tips that you need to apply for you to pass these exams. Some of them has been reviewed in the previous video. Do well to watch them. Before we go into the full details of today, take note of this, that the first antibiotics discovered was discovered by Alexander Fleming, and it is penicillin. Broad spectrum antibiotics, go and read it up: chloramphenicol, tetracycline, quinolones, rifampicin. Rifampicin causes red urine discoloration. Tetracycline, under 12 years, causes discoloration of the teeth. You note the narrow spectrum antibiotics like penicillin G. Hearing loss can occur as a result of aminoglycoside side effects like gentamicin. The fifth vital sign is pain, and all other ones. Now let's go back to the NCLEX. I want you to take note of this: the acute versus the chronic conditions. Acute usually comes first, chronic usually comes last. You care for acute conditions, patients that are having acute conditions before chronic conditions, because chronic is usually stable, acute they are usually unstable. Acute is life-threatening, it is immediate, it requires immediate intervention. Also take note of the fact that in case of emergency, you see questions like patient having pulselessness, breathlessness, it means death. There is tendency that they've died. Hence, you do not care for such patients. They are black in triage. In triage, they are black. We have triage colors. Triage simply means placing patients based on their condition, and that's the way you care for them. Triage color include red, yellow, green, black. Red is immediate. Right now, they need care, immediate care, like airway obstruction. Now, yellow, they can be delayed. They are serious, but they can wait, like fracture, burns. Burns without affecting the airway. If the airway is affected, like the neck, that becomes red. Green, they are minor injuries. They are known as walking wounded, like cut, bruises, sprain. Black, they are dead, no sign of life. Here you notice pulselessness, breathlessness, and all of this. You do not treat black. You do not treat black. Apply the law of utilitarianism. These people are almost gone. Therefore, focus on red and any other one that needs to be attended to. That is triage for you. And any other condition that should be managed immediately, especially in emergency. Now, take note of this. Take note of this. In physical examination is IPPA. The short form: inspection, palpation, percussion, accostation. Inspection, you are doing it with your eyes. But for conditions affecting the abdomen, it is IAPP. Inspection, accostation, percussion. Palpation comes last. Palpation comes last. Palpation comes last. Now, if surgery is done below 12 hours, that operation, that condition comes first, below 12 hours. But if it is more than 12 hours, it no longer requires that immediate or that serious attention. This is in case of NCLEX. Maybe they ask you question, so patient is below 12 hours, this one 24 post hours, this one less than 12 post hours. What I mean is that below 12 hours comes first. They usually come first. Especially post hours more than 12 hours on local anesthesia. You do not consider them much. You consider the ones less than 12 hours and under the effect of general anesthesia. General anesthesia. You also look out for vital organs. Vital organs. Vital organs include the brain, the heart, the liver, the kidney. If the vital organs are affected, a condition, take for instance, that affects the kidney. The kidney is a vital organ. That means that condition needs to be taken care of. Condition that affect the lungs, it needs to be taken care of because vital organs are affected. Unlike conditions affecting the bone, they are usually chronic, so you don't need to bother much. That is what I'm saying. Vital organs. You use the organ of the modifying phrase, not usually the diagnosis. Not usually the diagnosis. So there are a lot of things that you need to note. Also take note as a student nurse, sometimes they can ask you antibiotics for MRSA, methicillin resistant infections, you use vancomycin, MRCA. Now for the precautions, some precautions which you need to apply: standard precaution, airborne precaution, droplet precaution, contact precaution. All these things are precautions. The standard is the most common one that's usually applied. It is applied irrespective of the patient's condition, irrespective of whatever the patient is suffering from. Usually you apply standard precaution. If you're administering oxygen in case of your OSCE, you must have a cautious sign. There must be cautious sign. Always say it, there must be cautious sign. That sign is just to tell them that there is danger. Take for instance the CSSD, the central nervous system of the hospital. It is in CSSD that the hospital fight infection. They sterilize surgical instrument and every other instrument and material that needs to be used in the hospital. So it is very, very important. All these things are very important. CSSD usually have cautious sign. That's the way. If you are giving oxygen, there should be cautious sign. Next, there should be no smoking. There should be no smoking. Ensure that there is no smoking, because as long as there is oxygen, as long as there is heat, as long as there is fuel, anything that is combustible is said to be fuel. As long as there is oxygen administration going on, there should be no smoking, because oxygen supports combustion. Hence, it should be avoided. It should be totally avoided. You avoid it totally. In case of oxygen administration, still on oxygen administration, partial rebreather gives 60 to 90% oxygen. Non-rebreather is 60 to 90% oxygen, while venturi face mask gives exact oxygen administration. But simple face masks usually give oxygen. It helps to deliver oxygen, but this time around not specific. Delegation. If you are talking about delegation, that is giving somebody a task to do on your behalf. Licensed practitioner nurses cannot start IV. They can't start IV. They cannot miss IV. They can't hang IV. They don't transfuse blood. They do not transfuse blood. They do not transfuse blood. Licensed practitioner nurses cannot develop any plan. It is nurses that develop plan, but they can only reinforce teaching. They can only reinforce teaching. They do not start teaching. They cannot handle unstable patients. They cannot handle unstable patients. They cannot handle false vital signs, falsehood dressing, all those things. They can't handle it. They do not handle it. Whereas unlicensed assistive personnel, what they do is just to chart what they did. That's mainly what they do. They chart what they did. You cannot tell them to go and assess the patient or to chart the patient's response. Example, drug toleration, reaction to medications, all those things. All those things. But they can assist in things like bedbathing, oral care. Bedbathing, oral care, these are things that they do. These are things that they assist. Still under delegation, you tell supervisors or you report to your colleague if there are conditions that require workers reporting, confronting, and talking to their colleague. For illegal actions, you report, you tell the supervisor. For actions that can harm the person, that can harm people, can harm your fellow staff, can harm the patient, can harm every other person, you reason, you only confront. You confront. But if it is illegal, if it's not posing harm or risk, you just talk to the person. You talk to the person. You talk to the person. If it is not posing harm or risk. For family members, you do not delegate safety responsibility. It is important that you take note. For family members, you do not delegate safety responsibility. It is very, very important. Even non-hospital workers do not delegate safety responsibility. You only delegate that sometimes to sitters. Sometimes to sitters. It is very, very important. Sitters are people who sit next to patients that are admitted. They also render one care or the other. So they can assist in some things. It is very, very important. It is very, very important. And for your nursing council exam, there are things that you are expected to know as well. Take for instance, oxytocin is usually known as the love hormone. It is released by male and female during sexual intercourse. So oxytocin. Sometimes you can be asked oxytocin. Now, next, the baby's first immunization. The baby's first immunization is breast milk, and breast milk contains mainly water. It contains mainly water. How birth? Immunization of the baby after birth, at birth rather. The immunization of the baby at birth, not first immunization now. Now there is a phrase at birth is BCG, OPV, hepatitis B. That's what you give the baby at birth. Newborn weight loss can be up to 10%. They can lose weight up to 10%, especially in the first 1 week. Naxolone is used to treat opioid overdose. Is usually given to treat opioid overdose. Most abundant white blood cell is the neutrophil. The neutrophil. Universal donor is O negative. O negative. Universal recipient is AB positive. The fifth vital sign, it is very important, pain. Pain is usually the fifth vital sign. All these things are things that will help you to navigate your way, to pass your NCLEX and Nursing Council examination. Then hearing loss, I've said it before. Kindly go back to the former video, drugs that causes hearing loss, to watch it in full, to watch the full video. Aminoglycosides, example gentamicin, causes hearing loss. It damages the vestibulocochlear nerve or the 8th cranial nerve. Kindly share, kindly like, drop your comments in the comment section. I will reply to them immediately. Thank you. See you in the next video.